Good afternoon, my lovely nurses. I hope you are fine and your family is good. Today, our topic is hematological disorders in pediatrics. So, our all multiple questions are related to this topic. Our first question is: the nurse analyzes the laboratory result of a child with hemophilia. The nurse understands that which result will most likely be abnormal in this child. So always whenever you are giving the answer, keep in your mind the subject. Our subject is hemophilia, the topic is hemophilia, and the strategic point is most likely. So we will check which of the result we have to check for the hemophilia patients. So there are four options: number 1 platelet count, number 2 hematocrit level, number 3 hemoglobin level, number 4 partial thromboplastin time. So before going to the options, I will explain little about hemophilia. Hemophilia actually is a group of bleeding disorders. What happening in the hemophilia is the deficiency of specific coagulation protein. So now we will check which option is the correct options. So the platelet and hematocrit level and the hemoglobin level are actually are normal in the hemophilia patients. So our correct answer is there, partial thromboplastin time. As I told you, is a deficiency of specific coagulation protein. So our clotting factors functions actually may be normal in the hemophilia patients. So abnormal laboratory results in hemophilia indicate a prolonged partial thromboplastin time. So our correct answer is partial thromboplastin time. The nurse understand that the result of the partial thromboplastin time will be abnormal. So our answer is 4. Our second question is also related to hemophilia. The nurse is preparing home care instructions for a parent of a 10-year-old child with hemophilia. Which sport activity would the nurse suggest for this child? Number 1 soccer, number 2 basketball, number 3 swimming, number 4 field hockey. So here our subject is, as I told you, always check the subject. Our subject here is safe activity for the hemophilia patient. So as you know, I told you, is a bleeding disorder resulting from a deficiency of specific coagulation protein. So always the children with hemophilia need to avoid contact sports and to take precautions with other sports. For example, wearing a elbow and knee pads and helmets. That is not good activities for the hemophilia patients. So here our right answer is 3, the swimming, because swimming is really a good activity, the safe activity for the patients. So always suggest the hemophilia children, especially to the parents, to participate in the swimming activity, because the other activities are not good for the hemophilia patients. Our third question is related to thalassemia. The nursing student is presenting a clinical conference and discusses the cause of B thalassemia. The nursing student informed the group that a child at greatest risk for developing disorder is which of these? So in this question we will found the which people or the which group is the has the greatest risk for developing the this B thalassemia. So our A option is a child of Mexican descent, number 2 a child of Mediterranean descent, number 3 a child whose intake of iron is extremely poor, number 4 a breastfed just fed child of a parent with chronic anemia. So this actually the B thalassemia, actually first we will talk about what is B thalassemia. The beta thalassemia actually is an autosomal recessive disorder, actually is characterized by the reduced production of one of the globin chain in the synthesis of hemoglobin. So the beta thalassemia actually is an autosomal recessive disorder, number 1, and the number 2 reduced production of one of the globin chain in the synthesis of hemoglobin. So what happened due to this one, the both parents must be carrier to produce a child with the beta thalassemia major. So there is a type of actually thalassemia. The beta thalassemia is a minor, major. It's we will explain inshallah next time about this thalassemia disease. But here, which group of the people, or the which group of the students, which group of the people is the greatest risk for developing disorder? So here our answer is a child of Mediterranean descent, like for example in the Italian, Greek, they have more risk to develop this beta thalassemia disorder, is mostly found in the Mediterranean descent. Our next question is, a child with beta thalassemia is receiving long-term blood transfusion therapy for the treatment of the disorder. Chelation therapy is prescribed as a result of too much iron from the transfusion. Which medication would the nurse anticipate being prescribed? So due to the too much blood transfusion, patient have iron toxicity. The patient have too much iron in the blood. So chelation therapy mean, for example, the antidote of the iron. So which medication the nurse should prescribe to anticipate being prescribed? Number 1, dalteparin. Number 2, meropenem. Number 3, metoprolol. Number 4, deferoxamine. So which medication is the chelation therapy the nurse should have anticipate? So here the right answer is deferoxamine, because what happen actually, the major complication of long term the blood transfusion, to prevent the due to the too much iron in the blood, the organ can damage. The chelation therapy, actually we can do either we can use the defrasirox or the defroxamine, may be prescribed by the healthcare provider. Defroxamine actually is classified as an antidote of acute iron toxicity. If we will talk about the other medication, the dalteparin, the number 1, the dalteparin is the anticoagulation used as prophylaxis for post-operative deep vein thrombosis. So this one we are not using for the iron toxicity. Meropenem is an antibiotic, and metoprolol is a beta blocker used to treat hypertension. So these all three medications are not indicated for the chelation therapy. So defroxamine we are using for the iron toxicity patients. So our right answer is 4. Our next question is related to sickle cell anemia. The clinic nurse instructs parents of a child with sickle cell anemia about the precipitating factors related to sickle cell crisis, which, if identified by the parents as a precipitating factor, indicates the need for further instructions. So in this question, we will check which option is wrong, which option the parents identified but the nurse should precipitate, because they give the wrong answer, wrong options. So there are 4 options. Number 1, stress. Number 2, trauma. Number 3, infection. Number 4, fluid overload. So note the strategic words in the question. So in the strategic word actually need for further instructions. These words indicate a negative event query and ask you to select an option that is an incorrect statement. So which incorrect statement the parents identified and the nurse should have to anticipate? There is a 4 options as I told you before. So our right answer here is fluid overload, because in the sickle cell crisis, actually what is sickle cell crisis is the acute exacerbation of the disease which vary considerably in severity and frequency. What is happening actually is vaso-occlusive crisis. There is a splenomegaly, the size of the spleen increase, hyperhemolytic crisis, aplastic crisis. So sickle cell crisis may be precipitated by infection, but the mostly the dehydration, hypoxia, trauma, or physical or emotional stress. So stress, trauma and infection, These are the right option that they give the precipitating factors, but the fluid overload is not the right option, because patient for the sickle cell crisis always have dehydration, and the parent of a child with sickle cell disease, we have to encourage to increase the fluid intake due to the dehydration. So in the sickle cell crisis, patient don't have fluid overload, so that statement is wrong. So this is our correct option there. Our next question is related to hemophilia A. A 10-year-old child with hemophilia A has slipped on the ice and bumped the knee. The nurse would prepare to administer which prescription? Number 1, injection of factor X, the factor 10. Number 2, intravenous infusion of iron. Number 3, intravenous infusion of factor 8. Number 4, intramuscular injection of iron using the Z-track method. So here the strategy points you should have to see the diagnosis. The diagnosis of the patient is hemophilia A. And if you will if you know the hemophilia A is also a group of bleeding disorder resulting from a deficiency of specific coagulation protein, the hemophilia. And here we will eliminate the option 2 and 4, because if you will see in the option, number 2 is intravenous infusion of iron, number 4 intramuscular injection of iron using a Z-track method. So both are look alike, so this both we will remove. And if we will check the number 1, injection of factor X, that is we are not using for the hemophilia A patients. So iron and the injection of factor 10 we are not using for the hemophilia A patients. So number 3, the intravenous infusion of factor 8, that one we are using for the hemophilia A patient, because the risk for joint bleeding after a fall, and factor 8 would be prescribed intravenously to replace the missing clotting factor and minimize the bleeding. This is our right option is number 3, intravenous infusion of factor 8. Our next question is, the nurse is preparing to instruct the parent of a child with iron deficiency anemia regarding the administration of a child liquid oral iron supplements. Which instructions would the nurse give the parents? Number 1, administer the iron at meal times. Number 2, administer the iron through a straw. Number 3, mix the iron with cereals to administer. Number 4, add the iron to formula for easy administration. So first we will talk about the iron deficiency anemia. Actually, iron deficiency anemia is iron stores are depleted, resulting in decreased supply of iron for the manufacture of hemoglobin in the red blood cells. So there is a deficiency of the iron in the red blood cells, and oral iron supplements always we are giving with the straw or with the dropper. So we will eliminate 2 options from there, number 3 and 4. Why we will eliminate? Because that is comparable or alike. Always try to remove the 2 options who are look alike. See, 3 is mix the iron with cereal to administer. Number 4, add the iron to formula for easy administration. Never ever this iron we will not iron is not added to the formula or mixed with the cereal or any other food items. So 3 or 4 we will eliminate. If we will talk about number 1, administer the iron at meal times. So iron always give between the meals, because absorption is decreased if there is food in the stomach. Iron require an acid environment to facilitate its absorption. So always give food between the meals. And our right answer is here, administer the iron through a straw. Why we will administer iron through a straw or with the dropper? Because an oral iron supplements need to be administered through a straw or medicine dropper placed in the back of the mouth, because the iron stains the teeth. The parent would be instructed to brush or wipe the child teeth, or have the child brush the teeth after administration. That is very important, because the iron stain the teeth. So our right answer is administer the iron through a straw or either with the medicine dropper. Our next question is, laboratory studies are performed for a child suspected to have iron deficiency anemia. The nurse reviews the laboratory result knowing that which result indicate this type of anemia. Number 1, elevated hemoglobin level. Number 2, decreased reticulocyte count. Number 3, elevated red blood cell count. Number 4, red blood cell that are microcytic and hypochromic. So here the strategic point, focus on the subject. Our focus, if we will focus on the subject, the laboratory findings eliminate option 1 and 3, because number 1, elevated hemoglobin level, number 3, elevated red blood cell count. So in the iron deficiency anemia, always hemoglobin will be low and the red blood cell also will be low. So 1 and 2 we will eliminate. Number 2, decreased reticulocyte count. This is also incorrect because reticulocyte count always mostly normal in the iron deficiency anemia. So our answer here is number 4, red blood cell that are microcytic and hypochromic. Actually, the iron deficiency anemia, as I told you, is iron stores are depleted, resulting in decreased supply of iron for the manufacture of hemoglobin in the red blood cell. So what is happening? The result of a complete blood cell count in the children with iron deficiency anemia show decreased hemoglobin level and microcytic and hypochromic red blood cells. So hemoglobin, red blood cells and microcytic and hypochromic, they are low in the iron deficiency anemia patient, but the reticulocyte count is mostly normal and there is no so 1, 2 and 3, this is our wrong options. Our right answer is red blood cell that are microcytic and hypochromic. Our next question is, the nurse is reviewing a pediatrician prescription for a child with sickle cell anemia who was admitted to the hospital for the treatment of vaso-occlusive crisis. Which prescription documented in the child record would the nurse question? Select all that apply. So focus on the subject, identifying the prescription that need to be questions and on the pathophysiology that occurs in sickle cell disease. So here we will select the option that is not correct. Which prescription documented in the child record, the nurse should have to clarify. So number 1, restrict fluid intake. Number 2, position for comfort. Number 3, avoid strain on painful joints. Number 4, apply nasal oxygen at 2 liters per minute. Number 5, provide a high calorie, high protein diet. Number 6, give meperidine 25 milligram intravenously every 4 hours for joint. If we will discuss one by one, number 1, this restrict fluid intake. So you know the restrict fluid intake is not good for the sickle cell crisis. Is very important component. The fluid restriction prescription would need to be questions. So number 1 is our right option. Never restrict fluid intake in the sickle cell crisis. We have to tell the parents to increase the fluid intake for the sickle cell crisis patients. Number 2, position for comfort. Yes, this is a good option because this becomes sickle, so position for comfort is good for the patient. So this is our wrong answer because we will select the incorrect options there. Number 3, avoid strain on painful joints. Yes, this is also incorrect option because that is right statement. Number 4, apply nasal oxygen at 2 liters per minute. Yes, this is also incorrect option because that is correct statement, because the insufficient oxygen cause the cells to assume a sickle shape and the cell become rigid and clump together. And what happening, if it will happen, it will obstruct the capillary blood flow. So the apply nasal oxygen 2 liters per minute is a good option, is correct. So this is incorrect here. Number 5, provide a high calorie, high protein diet. Yes, always provide the high calorie and high protein diet to the patient because patient is already dehydrated and the the HB is low, red blood cell is low. So high protein, high calorie diet is good for the sickle cell crisis patients. Number 6, give meperidine 25 milligram intravenously every 4 hours. This is our correct option because that is wrong statement. Meperidine is not recommended for a child with sickle cell disease because of the risk for normeperidine induced seizures. What is this normeperidine? Actually a metabolic Metabolite of meperidine is a central nervous system stimulant that produces anxiety, tremors, and generalized seizures when it accumulates with repetitive dosing. If we will give every 4 hours for the pain to this patient, so what will happen? It will accumulate, and it will accumulate with repetitive dosing, and what will happen? Generalized seizure will come, tremors will come, anxiety will come. So the nurse would question the prescription for restricted fluids and the meperidine for pain control. Position for comfort, avoiding strain on painful joints, oxygen and a high calorie, high protein diet are also important part of the treatment plan. But the nurse should have to question for the number 1, restrict fluid intake, and number 6, give meperidine 25 milligram intravenously every 4 hours for pain. So here our right answer is number 1 and 6. Today's our last question is question number 10. The nurse is conducting staff in service training on von Willebrand disease. Which would the nurse include as characteristics of von Willebrand's disease? Select all that apply. So the question is related to von Willebrand disease. What is von Willebrand disease? Actually is a hereditary bleeding disorders characterized by a deficiency of or a defect in a protein termed von Willebrand factor. So the von Willebrand factor actually is a defect in a protein. The term we are using von Willebrand factor. So what happen if this disease will happen to the patient? Our options are number 1, easy bruising occur. Yes, this is right option. Number 2, gums bleeding occur. Yes, this is also right option. Number 3, it is hereditary bleeding disorder. Yes, this is hereditary bleeding disorder. Number 4, treatment and care are similar to that for hemophilia. Yes, this is also correct. Number 5, it is characterized by extremely high creatinine level. No, this is incorrect. So 5 is not the incorrect option. Number 6, the disorder causes platelet to adhere to damaged endothelium. Yes, this is correct options because it is characterized by increased tendency to bleed from mucous membrane. Assessment finding include what's the assessment you will found this in this disease? Epistaxis, gum bleeding, easy bruising, excessive menstrual bleeding. Treatment and care are similar to measures implemented for hemophilia, including administration of clotting factors. And elevated creatinine level is not associated with this disorder. So our right option is 1, 2, 3, 4 and 6. I hope you like the lecture. If you like, please share and subscribe my YouTube channel, and don't forget to push the bell button so you can receive my coming videos notification. Thank you very much. Take care yourself and your family. Allah Hafiz.